Routine Mammography Screening, A Must in Women's Health by Joanna Rueda, IDS 101, Cornerstone Seminar, Fall 2018. Introduction. When should you start routine mammography screenings? Routine mammography screenings should be encouraged for women starting at age 40 so that they might have a better prognosis, a decrease in mortality, and an informed decision making. Relevance of the research to me. This research is relevant to me because I personally gone through some painstaking days with a family member that was affected by this debilitating disease. She was diagnosed with late-stage breast cancer at age 45, and I believe she could have been diagnosed earlier with better screening protocols based on evidence. My purpose in writing this essay is to help other women who might be going through similar experiences and helping them make informed decisions about their bodies. The first main point in support my thesis. Multiple sources show that early detection and diagnosis of breast cancer leads to a better prognosis of the individual. The American Cancer Society let out a report in 2017 stating that the prognosis of invasive cancer is strongly influenced by the stage of the disease. That is, the extent of spreading of the cancer when it first diagnosed. When it comes to breast cancer, women who have routine mammography screening have a higher likelihood of receiving a diagnosis that could be life-saving. To increase their odds, they will start when they are at most susceptible at a stage of 40. The second main point in supporting my thesis. Routine mammography screening saves lives and decreases the mortality rates of women from breast cancer. The National Academy of Sciences, Institute of Medicine, and National Research Council in a consumer report pointed to understanding evidence that in many countries, screening mammography reduces breast cancer mortality by 20 to 30% in populations where most of the women get mammograms. However, the screening helps reduce mortality by 50%. The third main point in support my thesis. The most important point regarding breast cancer screening is making an informed decision. Women should be aware of the benefits and risks associated with routine mammography screening. As one article puts in, the decision on counting mammography remains an individual one, based not so much on age as on health status, personal preference, and the possible benefits and risks of both screening and treatment. Opponents of routine mammography screening argue that it leads to overdiagnosis and can cause medical harm to women. One such opponent states that they suffer the terror of being told that they have breast cancer and then are subject to biopsies and subsequent medical treatments that are painful, sometimes fraught with adverse events, detrimental to their overall well-being, inhibit their sexual relationship, and impair their immune system. Respond to the opponent's counter-argument. Not all women are subject to unnecessary procedures, resulting in medical harm, and in comparison to the life saved, the most it is the right choice. It is necessary to note that the risk of undergoing an invasive procedure for an area that proved non-cancerous is only 6%. Most of these will be fine needle aspirations, in which the physician uses a thin, hollow needle to draw a sample of tissue or fluid. The risk of undergoing an open surgical biopsy that turned out to begin is less than 1%. Alternative solution. Both sides agree that people are responsible for their own health. Providing them with both the risk and the benefits allows individuals to make informed decisions. Healthcare providers should emphasize the detractions of routine mammography screening as much as its attractions. Conclusion. On one hand, routine mammography screening can lead to overdiagnosis, but on the other, routine mammography screening allows for a better prognosis, a decrease in mortality, and informed decision making. Relevant thoughts. While screening is important, it is more vital to have open communication with healthcare providers about any health concerns. Reflections. This research paper has taught me how to seek reliable information and not be afraid of rewriting. Writing a research paper requires a lot of time to gather reliable sources and effectively use them. Next time I write a paper, I will be much more prepared. I know that I will have to set aside time to research first and gather my thoughts and then put them on paper. I have also learned to look out for plagiarism and to check my paper more dutifully for citations. Reflections on the course. A personal success for me has been the improvements in my grammar. While I am still facing challenges, I have found many resources available, such as eTutoring, Grammarly, and Google Translate. This course has taught me not to give up and to continue to work hard. I feel that this class has set the foundations for me to become a better writer. I would like to further my knowledge of writing and research, specifically in cohesiveness and citations.